see. Are we live? Yes. Okay. We are live. Now we're live for real.
Yes.
All right. Let's try this again. Hello, everyone. Welcome to tonight's episode of Navigator Nuggets. I am your host, Dr. Nicole Rochester. I am a board certified pediatrician and independent health advocate and the CEO of Your GPS Doc. I help family caregivers do three things: relieve overwhelm, reclaim their time, and ensure their loved ones have appropriate and effective health care. So as you all know, those of you who are longtime viewers, we do this every Monday night at 8 p.m. right here on the Your GPS Doc Facebook page. And my mission is really to give you all the information and the tools that you need so that you can be your own best advocate in healthcare settings. And I am so excited because today we have a special guest, Dr. Jerrica Dodd. So I'm going to tell you a little bit about Dr. Jerrica, and then I'm going to turn it over to her and let her fill in the gaps. But Dr. Jerrica and I connected, I don't know, maybe 6 months or so ago. And she is just phenomenal. She's like basically the pharmacy version of Your GPS Doc. And I'm so excited by what she's doing. So she is a pharmacist, you guys. She has master's degrees from, I think, Ohio State University and the University of Florida, doctorate degree in pharmacy from Florida A&M. Is that correct, Dr. Jerrica?
Yes.
And she has worked in retail pharmacies. She worked in hospital pharmacies. And similar to my journey, she left a long career in pharmacy to become an advocate and to start her own company. She is an entrepreneur, and she is out here doing innovative things related to patients and medications and partnering with patients to help them be their best advocate. So I just could not think of a better person to have on tonight's episode as we talk about medication safety, and specifically medication safety in seniors. So Dr. Jerrica, thank you again for being here. Please feel free to fill in any of the gaps. And I really would love for you to tell my audience a little more about your business and what you do.
Sure. So the only gap that I would fill in, and thank you for that lovely introduction, is the majority of my 21-year pharmacist career has been spent in the pharmaceutical industry. About 17 years working for several different companies over those 17 years. So yes, I do have experience in retail. I do have experience managing hospital pharmacy. And then the majority of the experience I have is in the pharmaceutical industry on the research and development side and the medical affairs side of the business.
Awesome. Very good. Even more interesting. So tell us about your company.
So my company is called Your Pharmacy Advocate, and it's an interesting story. And I'll be brief in sharing so we can get to the other things that you want to discuss. But I had the journey of being laid off from a pharmaceutical company back in 2015. And little did I know that in having that year off, that was going to be the year that I supported my parents in their health journey. So in June of that year, actually Father's Day weekend, my father was on that Friday diagnosed with stage 4 lymphoma. And he is a Vietnam vet and actually is diabetic as well. And so he was diagnosed with stage 4 lymphoma. And I was right there in the office with him when he got that diagnosis. And the best way that I can describe it was it was almost like someone had hit him in the stomach. Like what do you say when you get that diagnosis on a Friday? Which was very interesting how all that was delivered. And they're like, we'll come back on Monday and we'll talk about what we're going to do. And so if I can tell you that was the worst Father's Day that I ever have spent, because you get a diagnosis of on Friday of cancer, and then they say come back on Monday and we'll talk further about it. Interesting how that news was even delivered. So as we talk about advocacy, I think thinking about patients and do you really give someone that news on a Friday and you don't?
No, you do not.
So walking with my father through that journey, and a short 5 months later, my sister called me and said, "Mom's on the way to the hospital with chest pain." And that was the start of what ended in being triple bypass heart surgery for her.
Wow.
So, 3 hospitals later, triple bypass heart surgery. And what was profound about that experience is that my mom came out of that experience with what I can best describe as a dementia. And when I tell you that it, for the most part, lasted about 2 years. So now I'm supporting my father, supporting my mother, and she wasn't able to advocate for herself because, again, it was like she went in as my mother and came out as my grandmother, barely recognizing me to begin with and having really severe psychiatric challenges during that time. And so I just remember when she first came out of surgery thinking the first couple of days after surgery thinking, can that anesthesia just wear off? Well,
Yes.
you can imagine it had worn off. We were dealing with my mom in a state of dementia, it seemed like. And so that was a long journey. And 5 months after my mother's ordeal, I was told by the neurosurgeon that I needed to have brain surgery. So by now we're into
What?
2016. Yes. And so I had to have brain surgery for a condition that I have called Chiari Malformation, where the brain structurally sits a little bit too low in the skull, and it causes the squeezing of the brainstem and all kinds of neurological problems that I had been really kind of trying to get answers to all along, but not really realizing that this was a constellation of problems. And so after my surgery, I remember being in the hospital, in the hospital bed, and telling my father that when I get well, I'm going to build something to help patients. Because even as a pharmacist and as a patient, when my surgery happened, I found myself asking questions and speaking to my physician and nurse peers as if I was standing there at my own bed in a lab coat. And they were very taken aback, like, who is this woman? And how can she ask for an oral third generation cephalosporin? Nobody would know to ask that. So, it was very interesting. And that was what made me say, I said to my father, I said, everyone needs a pharmacist in their life at some point in time.
Yes.
And so it took a while, but I started building Your Pharmacy Advocate in 2017 after I was all well and was back up on my feet. And basically, Your Pharmacy Advocate is a virtual platform where every patient can have their own personal pharmacist. When you go to the doctor's office, you have 7 to 10 minutes on average in the exam room, conventional.
Yep.
And then when that's over, you're headed to the pharmacy to pick up your prescriptions. And usually patients are tired. They don't know what questions they have because they haven't had a chance to read the leaflet that will scare you into thinking, maybe I don't want to take it at all. And so I developed a company that you can have your own personal pharmacist who's not just happens to be the person that fills your prescriptions that day. They know your health. They know your profile, your health profile. They know your medications. So they're prepared to answer your questions when you have them, not at the moment that you pick up your prescription. So I know we'll talk further, but
I love it. I love it. I'm like bouncing in my seat, y'all. Because I mean, this is just, and those of you who have been watching Navigator Nuggets for a while, you all know how much I stress the fact that our healthcare system is broken. And, you may feel like, well, why do I need a health advocate? Or why do I need my own pharmacist? And I wish I could tell you that you don't, but you do. I mean, the reality is that there are just so many breaks in the chain in our healthcare system. And so many people fall through the cracks. And because of, like Dr. Jerrica said, the short visits and all the other inefficiencies in our healthcare system, you no longer can rely on your healthcare professionals. And like you said, most people don't even know the questions to ask. And that's the same situation I find myself in as a health advocate, is that, us being in the medical field, we know all the pitfalls, we know all the challenges, we know, we can see things before you all can see them. And I'm telling you, it is worth it. It is worth the investment to have independent professionals outside of your medical team, because like Dr. Jerrica is saying, she's keeping an eye on the medications the whole time, not just when you go pick up the prescription, not just when you're sitting in front of your doctor. And so when you work with independent professionals, we have your best interests at heart, and basically we can focus on you. We're not tied to a 10-minute visit or a 2-minute visit. We're not tied to insurance companies. So anyway, this isn't a commercial, but I just felt compelled to say that because I know that this is new, right? I mean, most of you are not accustomed to hearing about like a private health advocate. I hear people tell me all the time, I didn't even know people like you existed. I know that people weren't aware that they could have their own personal pharmacist reviewing their medications. And so, you know, these are the innovations that have become necessary with our current healthcare system. So I think that is phenomenal. So thank you. Yes.
If I may offer, sometimes people think of their pharmacist strictly as that pharmacist in the drugstore that has their head down or their phone to their ear and that's counting and
yes,
preparing. And that's definitely an important function and we need that. So your pharmacy advocate does not dispense any medications. However, one of the things that I personally, having been on this journey with my parents and then my own health journey, and it continues. One of the things that I think is that it's important to maintaining health is asking the question why. So last year I started my training in functional medicine because I think that oftentimes we put Band-Aids on chronic conditions.
yes.
So you can fill in any asthma, diabetes, high blood pressure, any autoimmune disorder. They're either a disorder of inflammation or toxicity, and we're putting Band-Aids on them by prescribing medications that handle symptoms, but we're not getting to the root cause of problems.
Absolutely.
And so I've had patients say to me, I've been on anti-anxiety and antidepressant medication for 20 years and nothing's changed. And like, so who allows these things to be refilled and refilled and refilled? I had an elderly woman to call me and say, she's definitely past retirement. She's in her 70s, but she called and said, when I used to work, now granted, she's definitely past retirement. When I worked night shift. So my doctor gave me a prescription for a benzodiazepine. So that's your Valium,
yes.
You know, things, Xanax, things in that category. And I'm still taking it now. And I was like, why? You're not even working anymore. You're not up all night. And she says, I don't know. They just keep renewing it. Those are the types of things that we ask questions about, and we ask questions of the patient and the practitioner, the healthcare practitioner, the doctors.
Yes.
So we have qualms in having communication, if the patient allows us, with their doctor, because why are things like that happening?
Such a good point. This is a perfect segue. I'm going to take a quick break and just welcome all of you. I see that we have quite a few people watching. Welcome Deneen, Lolita, Dr. San, who else? Derek, Anisha. The rest of you, if you are watching us live, please drop us a hello in the comments to let us know that you are watching and so that we can acknowledge you. And certainly for those of you who will catch this on the replay, let us know that you were here. Type in replay in the comments. So Dr. Jerrica, this is a perfect segue. So I'm just want to share, I ran across some very disturbing statistics as I was preparing for tonight's episode. And I'm just going to share a few of those with the audience, and then you and I can go straight into a dialogue. Okay. And so what I saw is that while older adults, and we're talking about here in the US, so while older adults make up only 13% of the population, they account for 34 to 35% of all prescription medications and 30% of all over-the-counter medications. So you guys can already appreciate that significant discrepancy. And then I also read that the average senior takes around 5 medications. And if they're in a nursing home, the average is about 8. So, you know, I can say that, you know, with my dad, and my dad wasn't even that old. I mean, he was 69 when he passed away, but he was in his mid 60s when my sisters and I, mid to late 60s, when we started to care for him. And one of the first things that I noticed, and that my sisters and I noticed when we became caregivers, is that my dad was on a boatload of medications. And for years, my dad had suffered from like this chronic dizziness and like gait instability. You know, he would fall and, you know, to the point where he wasn't able to drive anymore. And he was very unsteady on his feet. And he had multiple CAT scans and things like that. And they really didn't show anything acute, no evidence of a stroke or anything. But when we went to his, began going to his house on a regular basis and trying to just sort through all the mess, there were so many pill bottles, and he was on like multiple different medications for the same thing, multiple medications for his blood pressure, multiple medications for all these other problems. And as we began, accompanying him to doctor's appointments and things like that, I began to see how that happens because, he would go to, my dad was good for like going to the ER. So, he had his primary care doctor, who was okay. I'll probably give her a C. His previous doctor, I gave him an F, but then he got a new doctor. I probably would have given her a C, maybe a C plus, but he had his primary doctor and, so maybe she would prescribe things, but then he would have acute symptoms. So he would go to the ER. And then, this is before we were caring for him. So I don't know what he was telling them. I seriously doubt that he was bringing an up-to-date and accurate medication list. So let's say in the ER, yeah. So his blood pressure would be high. And, so then they would give him more blood pressure medicine. Then he'd go follow up with the cardiologist and he'd get more blood pressure medicine. And so I remember like just putting them all on the kitchen table and going through them and like writing down all the names and looking at, what they were for, and realizing that a lot of his problem was just due to side effects from, medications. And I mean, over time, we were able to get him off of some of them. He still was on a whole lot of medications. So I guess I just wanted to start with that. I think that just like you mentioned with the lady who's been on a benzodiazepine for, years after retirement, I'm sure you see this in your practice, as with your business, but what advice do you give to patients and their family caregivers to address this problem of patients just getting more and more and more medications, and no one ever really takes the time to stop and say, maybe we could take you off of some of these things?
And truly, Dr. Nicole, it is truly not a plug, but you need a pharmacist. You need a pharmacist to review your medications. I would say, depending on how often you're getting new prescriptions, but I would say at a minimum every 6 months to a year, if not a lot is changing, from month to month. But so you describe your father and say, okay, he was going to the emergency room and then he was seeing the cardiologist. So I imagine that some of the side effects he was experiencing were probably from low blood pressure, even though it was high blood pressure that they were trying to manage. And so then you have fall risk. And what happens when the elderly fall and they break bones? They usually don't heal as fast. They end up in the hospital. They get pneumonia because they're immobile. And unfortunately, death is usually next. And so and you see it a lot because women tend to live longer. And that's what happens to little old ladies. They fall, they break something, and then they're in the hospital and you go, what? She just fell. And now they've died from a complication of having pneumonia. And so I would say it's important for everyone to have a pharmacist to ask those questions. So why are we on this? Why do we have, and I find patients who are seeing a primary care physician, but they're on 3 and 4 blood pressure medicines. I feel that when you're on 3 or 4 blood pressure medicines, you need to see a cardiologist, because what we've got is heart disease, if you will, and it's not obviously being controlled with 1 or 2 agents. And again, I say a pharmacist can help ask those questions. Wehy are we doing this? Helping patients understand how to monitor their blood pressure, how to keep data so that when they get to the office, we're just not looking at one data point of what your blood pressure is right now. After you've been sitting down, you got up, you came in, you got on the scale, you know what your blood pressure is. And that's only one point in time. But I teach patients how to log and keep a record so that when you're going in to have that conversation with that healthcare practitioner, you're having a conversation that is based upon more than one data point.
Yes, which is so important. And I know as a former primary care doctor, and I know all the primary care doctors, some of you may be watching, I know that you all are telling your patients to do that. You are telling them to take their blood pressure at home, to purchase a cuff or go to one of the local drugstores. Unfortunately, I think a lot of patients don't follow up on that. And, I think it's just important. This is why it takes a team. Yes. It really does take a team to take care of patients. And, I think I'm going to say something. I'm going to be very transparent for a moment because I know I have some of my doctor friends are watching. So I'm just going to address the elephant in the room. So you are basically advocating for managing a patient along with their physician team.
Yeah.
And you have indicated that there are some gaps. And y'all, look, we can't even deny that our patients are slipping through the cracks. Now, you mentioned something earlier about with the patient's permission, you will call their doctor.
Yes.
So this is the elephant in the rooms that I'm going to discuss. I know for a fact, and I'm going to be honest, I have been there. I have gotten calls from pharmacists in the past, and I have been annoyed. I'm just keeping it 100% real. And my initial instinct was, okay, like I know what I'm doing, especially if I will say that I haven't had many as a pediatrician, but the few that I've had were actually like the pharmacist was incorrect. It was a pediatric patient, and I don't know the details, but so I left the conversation feeling a little bit annoyed. Like, okay, you're calling me, like I'm a physician, I know what I'm doing, but that was totally the wrong attitude to have. And as a caregiver, I definitely got to see that there were mistakes that were made by my dad's physicians. And many of them, like you alluded to, and like I've mentioned to you guys, before Navigator Nuggets, it's a nature of the times, way back in the day when you had that one family doctor and he knew you and your mom and your dad and your grandma and all of, everybody went to the same doctor. And, we had paper charts. Yes, I mean, I love the EMR, but we had paper charts and the doctor knew your health history backwards and forwards. And, and I'm saying you, but none of us have experienced that healthcare system. Okay. That's probably my grandmother's healthcare system. But there was a time when it probably was appropriate. Your care really could be effectively managed by a small team or maybe just one doctor. But we don't have that anymore. We have a system where patients are rushed in and out of exam rooms, where doctors have panels in the thousands, where, doctors don't really have an opportunity to a large degree to really know their patients. And information is being transmitted electronically. Sometimes it's not accurate, it's not timely. And so we absolutely have to adopt this team-based model. And so I just wanted to say that because I'm sure I may have some colleagues watching that are like, I don't want her calling me up.
and with all due fairness, I want to give you some points to consider about patient behavior.
Yes.
So, patients, believe it or not, and you probably already know this, patients like to get all dressed up when it's time to come see the doctor. So when you walk in the exam room and you say, are you taking your medicine like I prescribed, or however you ask that question, what are they going to say?
They're going to lie.
Right. And so, but I promise you that the pharmacist will get to those answers and the correct answers. That we I know it was one of the major chains that had that slogan about that America trusts, and so we're not doing any advertisement for anybody, but the pharmacist, I promise you, can get conversation going with patients. So when we're going through patient profiles and they're telling us all the medications, I sat on the phone one day with a woman who was about my age and had just been given chemo for breast cancer. And so I listened to her rattle 14 medication bottles. And so after she told me all that she was on, I just asked, how are you using each of those medications the way the doctor said? And she paused and I waited. And she said, well, this one, he said, take, for example, 3 a day, but I don't take 3 a day. I've been taking 2 because I think 3 is too much. And I said, well, is your doctor aware of that? No. But when that person gets in your office and you ask the question, they're going to say yes. And so the patients don't want to bother the doctor. True. They don't want to call back. So you think about these automated systems where the patient calls in and they have to press 1 or 2 or what have you to leave a voicemail message. Well, that's cumbersome. And people don't want to do that, especially if they're not going to get the call back from you, the physician. They're going to get a call back from one of your nurses. Can you believe I had a patient whose blood pressure dropped very low? That patient called me and said, what should I do? And I said, have you called your doctor's office, primary care physician? And he said, yes. And I said, what did the nurse instruct you to do? Because I knew he didn't get a chance to talk with the doctor. He said, well, the doctor was out and the nurse just told me to stop taking all my blood pressure medicine. And I said, absolutely, I disagree with
Oh
that.
gosh.
Right. So I think that it does take a village and it does take a team to be able to manage these patients, because what some of the information they get. So there, they said the doctor wasn't there. And so the nurse says, stop taking all. He was on 4 medications, which hence my suggestion. If you're on 4 medications for blood pressure, I think we need a cardiologist on board. But he called a pharmacist to say, what should I do?
Wow.
I think pharmacists are able to, plus, how many of your patients are actually coming in your offices and saying all of the over-the-counter or all of the supplements, GNC and Vitamin World and other supplements? And I'm sorry, I may not be supposed to mention names, but they sell supplements and marketing is very powerful. So how many of your patients are coming in and telling you the weight loss or the muscle building supplements or whatever it is that they're on? And even if they tell you, how do you know that those supplements are not interacting with their medications?
Yeah, and I'm going to be very honest, and again, I'm a pediatrician, but we had to take, pharmacology and all of that in medical school, but I'm being very honest, that is not like that is not our area of expertise. And certainly I think certain specialties, you're going to be familiar with the common medications that you prescribe, and hopefully, doctors are familiar with those common interactions. But you're absolutely right. If a patient were to tell me, oh, I'm taking this particular supplement or this particular vitamin, I would have to go look that up. I mean, that's not just information that I'm going to have in my head. And again, in a typical primary care setting, am I going to have time in that moment to look up, the 5 supplements they just told me they're taking and look and compare that against the 18 medications? Probably not. So, I do think that this is underutilized. And I mean, I just talking to you is just making me think of so many things, but I'm wondering like how we can even really get the word out to physicians. I mean, today I'm primarily focusing on patients and caregivers and lay people, but I'm seeing an opportunity, for more partnership between physicians and pharmacists, particularly in the outpatient setting. I can say in the inpatient setting, boy, I love my pharmacist so much. We had some amazing, and I worked mainly in community hospital settings and pediatrics. So thankfully they invested in a couple of pediatric pharmacists, and they were a lifeline. I mean, not just in the NICU with all those medicines and TPN, but we would often call the pediatric pharmacist for advice. And we really had a very collegial relationship. They came on rounds with us. They rounded in the NICU every single day. On the inpatient floor, because our patients were pretty stable, they rounded, I think 2 or 3 times a week. But they were always available by phone. And there were so many instances where during rounds, the pharmacist would catch something, some error or some interaction that the rest of us had missed. So I'm just reiterating how valuable that your services are.
And some of the things that I think people just maybe are not maybe mainstream, but let's take, and they're definitely, genetic testing is definitely available for more than patients that are on psychiatric meds. But let's just use psychiatric meds.
Okay.
An example. So when a patient comes in and it's determined that they're depressed and they're given a psychiatric med, first of all, those meds generally take some time to work. So we're usually looking at 3 to 4 to 5 weeks for these meds to work. And then the patient comes back and says, oh, no, it didn't work. So then we try another one. How about having a pharmacist that can have a genetic test done on that patient and can show you these drugs won't work, these will. So you're not doing that trial and error, because when you're depressed, 4 or 5 weeks is a long time to wait to see if anything happens.
Yes.
And if nothing happens, and then you have to start a new medication. So we talked earlier about adverse events and how, one medication can cause adverse events. And then now we're adding another one to combat and so we're getting all caught up here. And then when we talk about the use of resources, it's not a very useful or a very efficient way, in my opinion, to keep doing trial and error well, let's try this, let's try this. Let's look at the patient that you put on because you determined that they have a methylphenidate deficiency, and you put them on, one of those agents for ADHD. Well, what about all the sequelae that come after that from the nutrient depletion? And so now we have nutrient depletion, and then the child is not sleeping. So then now we're adding something
to make them sleep.
And so we're affecting melatonin. We have all kinds of nutrients that are depleted. Who's watching that?
Yeah.
Because I can tell you that just about everything from metformin to the psychiatric meds to meds for ADHD, what have you, almost any med that you put a patient on, it's going to deplete nutrients in some way. So who's watching that? Who's saying, I would suggest, doc, if you would consider drawing, this blood level, or consider supplementing with this nutrient, because you're treating one circumstance, but yet creating another one. And I think that there's no one better to support you in that, not doubting your diagnosis, not doubting your treatment plan, but if this is the treatment plan, can I give you some things to consider in that? Yeah. So we do actually provide consults for healthcare practitioners. So if you have a patient and you just say, I want a peer consult. I just want a pharmacist to look over my shoulder, take a look. This is complex. I just want to make sure there's nothing I'm missing. It's not to insult your intelligence about what you know, what you don't know, how good you are or not. Yes. But my understanding is liability insurance is pretty high, and that we live in a very litigious society, and patients, you don't want them to come back and say, well, that you didn't do your due diligence. And obviously no one intends to set out that way. But I think it's really important to embrace help, especially with the confines of managed care and all that you have to contend with, in that you don't have a lot of time to spend with that patient. Wouldn't you want a healthcare practitioner that can fill in that gap?
Yeah, absolutely true. And I love, you're a pharmacist, but yet you are basically advocating for non-medicinal treatment of a lot of these common conditions, which I think is phenomenal.
I think if it's possible, I do believe that sometimes that's very necessary, but most of the chronic conditions that our population suffers from is a result of our standard American diet, which is really sad, and we know that, as well as our lifestyles, in that we don't move enough. And so that's one of the places that we start with patients, because before I'm going to have a conversation with any patient's physician about decreasing or discontinuing any medication, let's say for diabetes, for example, I have to know that you are truly going to change your health habits, and that you're not just changing them for the moment, but that this is a long term. And so we talk about, monitoring that blood sugar, that fasting blood sugar, such that you keep it under control. And you are able to see when patients say, oh, well, I ate a little later last night. And I said, what was your blood glucose the next morning? And, oh, it was a little high. And then you're able to see how to control your blood sugar with food and activity. And then we won't have a need, or as much of a need, for diabetic agents, because I think that we either are in the business of helping people be well and stay well, or just maintaining sick care, if you will.
That's it. That's it right there. And we've talked about that. I mean, we have a sick care system in the United States. We do not have a healthcare system. I'm just, as you're speaking about nutrients, and one of my co-hosts on our podcast, The Real RX, Dr. Felicia, she's a family practice physician, and she has a new direct primary care practice, but she is like all into, sleep and really like true wellness. And she's always talking to us about vitamin D and, just all these things. So I'm gonna have to make sure that I tag her so that she can come watch this, because you and her would just be like, oh my gosh.
You talk about sleep.
Love this conversation.
You talk about sleep. I am not a proponent. Of course, there are any number of prescriptions for sleep on the market, but I'm not a proponent of using them. I say, where can we start first? Do you have a regular bedtime? I did a whole Facebook Live back in January, about 15 minutes on things that you can do that are non-pharmacological, meaning non-medicine, to help improve your sleep. And
Love
then
it.
we do have to get to the point of some type of intervention. Then I would say, can we start with something that's a natural product so that there's less chance, hopefully, of side effects or what have you? And let's just see. And I think that every patient is different, which is why I feel that practicing personalized care for patients is really important. Because what makes me sleep, it may be CBD for one patient, it may be, something else, melatonin for another patient.
Yes.
I think that you really have to consider a patient's biochemistry and determine what's going to be best for them.
Yeah.
And I believe in doing that with the support and with the communication with the physician. My goal is not to practice medicine. I am not a physician. I don't tell people not to take their medication, but I give them and their practitioners things to consider.
Mm-hmm.
You may want to consider this lab value. You may want to consider this dosage or what have you, because I believe that, as I said, as you said, it takes a village.
It really does. I want to address a couple of the comments, and then I want to really kind of transition in our last maybe 5 to 10 minutes to some specific tips that we can offer to seniors and those who are taking care of seniors. So you had mentioned earlier about genetic testing. And so Marcia, or I don't know if it's Marcia or Marcia, so I apologize, but I think it's Marcia Friedman says, I highly recommend pharmacogenetic testing for anyone being prescribed drugs for depression. It can save money and valuable time in figuring out what might be best for the patient. So again, now I'm a pediatrician, so this is, I don't deal with this a lot. And now, then I was hospital-based. But my question is, this genetic testing, is this typically covered by health insurance, or are these tests that the patients will typically have to pay for out of pocket? Do you know?
So I think it depends on the health insurance. I know some health insurances may cover them, and they may have a stipulation where after you've failed one, then they'll say, okay, before we start trying another one, we'll pay. But I would surmise, and I did a video on this, and this is a whole nother topic. Maybe we'll regroup again another day, because this has been great.
Yes.
But I would surmise that insurance, I think, has given our society a different perspective on health, such that, and I understand that there will always be the population that cannot afford necessarily to make a personal financial investment in their health. I totally get that. However, those that can, I think that better health will be achieved when you make a personal financial investment in your health, meaning you're going to have to pay for some things out of pocket.
Yes.
You think about the amount of resources that can be used if you don't do genetic testing, because maybe your insurance doesn't cover it, but you're going round and round with potential adverse events, medications not working, lost time from work. I mean, when you look at it from a societal perspective, whether it's from the payer's perspective or the patient's perspective, we're losing a lot here.
I agree.
Productivity, caregivers, days off, from work. There's all kinds of costs that most people don't think about. And I totally understand that. So when you're weighing what it costs not to pay for a test, if for some reason your insurance doesn't pay it, and you weigh what it does to pay for a test, I think it might be worth considering that investment.
Absolutely true. And you're right. I mean, that is a total mindset shift and a paradigm shift that I don't know if I'm going to see this in my lifetime, but I feel like slowly but surely we are making that shift, and that, patients and caregivers are just fed up. And I think more and more people are discovering that they really aren't getting what they thought they would get from the healthcare system. And despite these high premiums and co-pays and co-insurance and all that stuff, we still are sick. We are not a healthy society. And so, the part that pains me about all of this is that, like you mentioned, there are some who can and should, just be able to pay. But what pains me every time I talk about the whole economics of healthcare is that there are some people who just can't. And even thinking about healthy eating, and we're getting a little off topic, but Whole Foods. I mean, your average your single mom of 4 making $35,000 a year, she cannot, that's a luxury. That's a luxury that she can't even afford, organic foods and fresh fruits and vegetables. And so it honestly like pisses me off.
Oh yeah.
That we live in a country where those who have the means can afford, all these non-medicinal treatments and genetic testing and, grass-fed beef and all this stuff. And everybody else just has to eat, the food with the chemicals and all that stuff.
But I will also say that we also have to consider, and again, I know you and I we could go on for we could have another couple of episodes. But I think that it's also a shame that the processed food is cheap enough that mom of 4 that you just spoke about, that she can buy the processed food, but to buy better fruits and vegetables and meat and lean proteins for her family, that seems to be more out of reach.
Yes.
The processed food that's in a box, that's in a frozen, in a bag, that all that has to be done is microwave. I think it's unfortunate that in our country, the profit that's made from all the fat, the sugar, and the salt that we consume that's processed, that food is cheaper than the food that actually sustains life.
Absolutely. And I cannot help but mention that Popeye's chicken sandwich that y'all been out here going crazy over. I have not indulged. I don't plan on indulging. And I'm not judging y'all. My husband FaceTimed me the other day from the car. He was so excited because he finally got that chicken sandwich. So, okay, that's fine.
The power of marketing.
Exactly.
Really marketing it for them. And again, I know that's another conversation. They have become very wise and have America marketing their sandwiches for them.
That's right.
They don't even really have to spend. The marketing budget is probably not as high as it normally would be.
Oh, yeah.
Society is marketing for them.
Exactly. So it's really about a shift in our values, and just like you said, I mean, a lot of it is a mindset shift and things that we think we can't afford. Some of us, not all of us, but some of us really can. And for the rest, we need to figure out a way to subsidize that, because we are just making ourselves sicker and sicker. So let's transition a little bit to seniors, because with our seniors, and all of us are subject to medication errors, medication side effects for sure. And we've already shared some of the information related to that. So all of you, it would behoove you to be your advocate to make sure that you have an accurate and up-to-date medication list every single time you go to the doctor. If they're changing your dose, I recommend you pull out that list and make that change, whether it's in your phone, whether it's on a piece of paper and a notebook, however you keep up with your medications. If they're stopping a medicine, adding a new one, you need to make note of that, because when you get home and you have all those medication bottles on your table or in your medicine cabinet, you may forget, wait, which one did he tell me to stop taking? And which one of these, I'm supposed to take 2 pills now instead of 1 pill. So you need to, again, this is on you. Like, we have to be our advocates. And so I encourage you to do that. But when it comes to seniors, it's even more imperative because there's a lot of things that happen. Seniors, there are physiologic changes that happen as we age that make us more susceptible to medications in general, to the side effects from medications, to all of these interactions. There are changes in your fat distribution, there's changes in your blood flow, your liver and your kidneys aren't working as well as they used to. And those are the 2 organs that, really excrete some of these medications that we take and process some of the medications. So what do you recommend? Are there any tips that you have specifically for older patients or those of us who may be taking care of aging parents, aging grandparents, to really, make sure that we are keeping them safe when it comes to their medications?
Sure. So for elderly patients, as well as those who may care for them, it's really important, as you said, to keep a list of all medications, an updated list. And I would even venture to say to keep that list in more than one place. So I think, one on the refrigerator or one that stays on the kitchen counter or on the table in the kitchen or something is important in case someone ever has to go to your home and try to figure out what's heads or tails. There's a list there that they can find readily. I think the refrigerator, like I said, is a great place, but that list should also be kept on the patient, in their wallet, in their
Yes.
purse, because as they're making changes, as you said, you can pull it right out and go ahead and make the changes right there. The other thing that I think is important is for a caregiver or someone else in the family to have knowledge. When my platform is expressing, and I'm very passionate about patients becoming the CEO of their health.
Yes.
And with that, I think it's important that someone in your family knows what's going on. Sometimes seniors may live alone, may live far away from nearest relatives, but I would say that a relative or a friend needs to be aware of what you're taking. And so I talk about having the conversation so somebody knows what you're taking and what you're on, because if you're taken to the hospital and you're unconscious, someone needs to be able to have that conversation with the emergency medical team.
Absolutely.
So that's one thing that I advocate. The other, as I said, is the patient or the caregiver or some other healthcare practitioner, and the pharmacist is what I recommended, looking in on those medications and saying, do we really need this? So for example, patients get put on the proton pump inhibitors, and they're not supposed to be on those long term. That's one of my soapboxes. But because it lends to all kinds of other problems later. And then, when you have patients who don't have enough stomach acid because they've suppressed it for a long time. So who's asking, okay, it's been this amount of time, can we consider coming off this medication or what have you? So someone to look in and review the medications, not just, you only having a list, but is that list reviewed periodically to have a conversation, because there may be multiple prescribers, as you talked about your father. Mm-hmm. And I've known physicians to say, well, that doctor prescribed that, I'm going to leave that alone.
Yes. And I mean, and I get that, if that's not, particularly when you have specialists involved.
Right.
And, I'm not, as a pediatrician, I wasn't going to touch something that the pediatric psychiatrist prescribed, or the pediatric neurologist or the endocrinologist, and so you're right. There's kind of this fear if it's outside of your specialty, but that's when we need to be picking up the phone. If we're not comfortable doing it ourselves, and we know that our patients aren't going to see this specialist for another 6 months, 9 months, a year,
right?
That primary care doctor, it really is their job to pick up the phone and call and say, hey, does my patient still need to be on X medication?
Right, definitely. The other thing that I would recommend is helping that, if there's a caregiver involved, or if, this is one of the things that we do for our patients, is we help them prepare for doctor's visits. So the patient just doesn't walk in, sit on the table and say, okay, what you gonna tell me today, doc? But the patient walks in, has prepared and has their questions in advance, either the patient, if they're, able to do so, or the caregiver. What are the questions we're coming to the appointment? So 7 minutes goes by really, really quickly. 10 minutes goes by really, really quickly. If we have those questions written down, then we can, after the initial exchange of pleasantries, we can get right to it, because trying to jog your memory, that may take a minute right there. And so having your questions prepared to ask, having your data, your high blood pressure, or your blood pressure readings, if you will, your blood sugar readings, there and ready to go. I think it's also important for patients or caregivers, if they're not able to have something to write on, a little notepad to take notes. I can't tell you how many times I have asked my own father. He knows that he's used as my poster child for why, you need a village to help patients. I can't tell you how many times he has come back from the doctor, because he'll say, oh, no, I can go by myself. Okay, well, when he comes back, I always say, well, what did they say? What did he or she say?
Oh my gosh.
Oh, I don't remember what they called that. I don't remember what he said. I said, well, did you ask for a copy of lab values? Did you ask, for any type of printout of your summary? And I know with a lot of the EHRs now, we're able to provide printouts and what have patients, but literally he will come back and you're like, well, were you listening? Did they say anything?
Girl,
I don't remember.
That was the story of my life. Caring for my dad. Like before we were caregivers, I was peripherally involved, and I would ask him questions, give him a call. And inevitably, just like you said, he'd be like, oh, they started me on something new. I don't know the name. Or
I don't know
said
what
I
it
have
is.
something wrong with this thing. I have to go take some test.
Yes,
Test. I don't know.
yes. My father was preparing for a procedure that he was told he needed, and I said, okay, so we're going to do one leg on this week, and the next leg this week, and the week after. And I said, well, did we ask? Are there any other alternatives? Do we have to go straight to a procedure? And he said, no, I didn't ask. And I said, well, can you call back to the office and ask if this is not life or death, which I don't think it was, because if it had, he would have been admitted to the ER right away. Yes. But if this is not life or death, can I try, the compression stockings and elevating my feet for a month or two and see if that helps before we go? But he did not ask any questions. So I think I say all that to underscore, when you're going to the visit, prepare the day or two before. What questions do you want to ask? And when you're told that information, if you can't think of what questions you have, maybe schedule a follow-up appointment to say, okay, when you get home and you process it, either you can make a call back or you schedule another appointment to come back and ask your questions. Because I think that we're, just to kind of shuffle along and you're not really an active participant in your care. I don't think I think you want patients who are on top of things and want to be the CEO of their health and want to play an active role, not just a passive role, because when they're playing a passive role, they may or may not do what you recommend.
It's absolutely true. You are preaching my language. Y'all know. Now, y'all know how many times have y'all heard me say these things? This is just
before this.
I love it. I love it. And you all know we have talked about the Ask Me 3 campaign and, the 3 questions you must ask every time you go to the doctor. We talked about the 4 questions you must ask about every treatment. I don't have time to review all that information right now, but scroll through the videos and you can find those episodes. But Dr. Jerrica is absolutely right. So for those of you who are, getting up in age, or for those of you who are caring for seniors, it is really, really important that, just to recap, you need to speak up, you need to ask questions, you need to understand what these medications are for. And we didn't use the term, but there's something called de-prescribing. And you need to ask your doctor, your nurse practitioner, whoever's your healthcare provider, every time you go to the doctor, there is an opportunity potentially to de-prescribe. And I'm telling you, as a physician, we don't think about this. Sometimes we need you all to pull our coattails and to tap us on the shoulder and to be that friendly reminder, because as Dr. Jerrica shared, and as I share with my own personal experience with my dad, medications tend to get added and added and added and added, but it's very rare that someone in the healthcare field, the doctor, the nurse practitioner, says, oh, well, let's try to take a few of these off today, unless you are an active participant. And so we do have patients who have diabetes and they don't want to take that insulin. And so they are actively losing weight, modifying their diet. And so they go to the doctor and say, doc, these are my blood sugars. I've dropped 20 pounds. Can I get off the insulin now? That's more common in those type of situations. But when we have our elderly loved ones, we don't think about that. We don't think to advocate. We just assume that they need these 3 medicines for blood pressure and 2 medicines to fall asleep and 4 medicines for, the fluid in their legs and all this other crazy stuff. And I'm not saying that we're ever going to get to a point, where your elderly loved one may not need any medications at all, but I can almost guarantee you that they are taking more medications than they need. And so you need to speak up and ask, does he or she still need to take this medication? And certainly if you think there are side effects, you need to speak up about those things, because I know sometimes, like you alluded to, and I'm just going to say we physicians will prescribe yet another medication to treat the side effect that you're having from a medication. How crazy is that?
Another thing to consider is, as a physician, say you see a patient once a quarter, and that may be, more frequency than normal. Maybe you see them twice a year. Maybe you see them once a year, once, twice, 4 times a year. If you think about this patient seeing their average pharmacist, even in the retail setting, they're going to see that pharmacist potentially 12 times a year.
Wow.
Compared to the number of times that you see them. This is why it's really important to think about that entire healthcare team and to think about who else has eyes on my patient that can help me manage them? Because I think ultimately we all want the same outcome. We want patients to be better. We don't want them on too many medications or falling from adverse events or anything else like that. So think about it from that way, from how many times that pharmacist has to interact with that patient, be it virtually, be it as a consultant, be it as, you know, a pharmacist in the retail setting, if they have the opportunity to engage, compared to the number of times that you see the patient.
That is such a good point. Okay, we're going to wrap this up. We're going to have to do a part 2. I just want to read through some of the comments real quick. So Dr. Donna said earlier, and I think she had to sign off, providers must review med lists every encounter, even specialists. Often that doesn't happen. Absolutely. Let's see. T. Anderson says, I appreciate Dr. Dodd's conversation. There are so many side effects associated with some of these prescriptions. We started CBD products and left all of the other meds alone. Awesome. Yeah. Betty says, I made little business cards with my mom's meds for her. My daughter and I have a copy of that card. I learned this the hard way after my mom was hospitalized. I love that idea of making little business cards. Sadiqa is a pharmacist, and she says that she has worked on a medication reconciliation team at her hospital for patients being discharged. One of our primary duties is to create an updated medication list that each patient receives at the time of discharge. Love that, Sadiqa. Absolutely love it. And Marcia says that's a great reason to make sure to fund your HSA account to the max. And she's talking about Medicare and, you know, if you're going to be eligible for Medicare. So basically funding that HSA so that you have money to be able to, you know, maybe pay for some of these expenses, some of these genetic tests. And the last thing I'll say about safety, this is a very like simplistic thing, but I'm sure all of you have seen those pill containers, you know, the Sunday, Monday with the days of the week on it. Little things like that can go a very long way with helping your loved one, particularly if they're elderly, if they may be having, you know, some memory challenges, helping to organize them so that they're not just grabbing random pill bottles and trying to remember, did I already take my medication this morning? There are also like electronic pill dispensers that combine with like an alarm clock. And there are some that like automatically I've seen, like, you know, the alarm goes off and some little pill drawer like comes out. So it's almost like foolproof. So, you know, if you are a caregiver, start, you know, Google, look online and start to look for some of these products that may help you provide a safer environment for your loved one. Absolutely consider strongly partnering with a pharmacist. Yvonne asked earlier how much it costs for a personal pharmacist. So we're not going to share that information on the live, but Dr. Jerrica, if you could please drop your information in the comments, because I would love for my audience and any of you who are watching today, if you are interested in working with Dr. Jerrica, finding out more information about her company and the services that she provides, I highly encourage you to do that. And then what's your Facebook page if they want to follow you?
So the Facebook page is Your Pharmacy Advocate. And you can find us, like I said, right here on Facebook. And the website is yourpharmacyadvocate.com. And so either the website or the Facebook page. On the website, you're able to go to the contact form, fill it out, put your information in, and someone will, you know, get back to you and follow up and find out. So the reason that we don't discuss price is, one, it depends on, every patient's different and every patient has different needs. And so it's hard to say what a price would be for you if we don't know what conditions, what medications, what your concerns and what your issues are. And so what we do is a consultation to even determine if we can help you or not. Because when I built this company, I was very adamant that we would not take a patient that, you know, we could not help. So for example, if a patient has a terminal illness and there's not likely a lot that can be done beyond palliative care, then we wouldn't take a patient like that. So we like to look at each patient and assess, you know, what their needs are.
I love it. So yourpharmacyadvocate.com is her website. Go to Facebook, follow her on Your Pharmacy Advocate. She has tons of useful information on her Facebook page. I am definitely going to have you back, Dr. Jerrica. This has been amazing. I have learned a lot. I know that my audience has learned a lot. So thank you again for being my special guest. And I look forward to talking with you both here and offline very soon. Guys, thank you all for hanging in there. I know this has been a long one, but I hope that you enjoyed it as much as we did. I think that we shared a lot of useful information. Please share this video with your loved ones, your coworkers, your church members. Everybody needs this information. And Dr. Jerrica and I both have a mission of really empowering you all with the knowledge and information that you need so that you can be well and so that your family members can be well. So please share the video with anyone who you feel can benefit. And I will see you all next Monday night at 8:00 p.m. for the next episode of Navigator Nuggets. Take care, everybody.
Thank you.
Let's see. Always, let's see, let me figure out how.